Hello, welcome everyone to today's Collaborative Sciences Center for Road Safety Research to Practice Bites webinar, our final installment in the series. So glad you're here for that. Today, we're going to focus on lessons learned from rapid COVID-19 era street transformations. For those not familiar, CSCRS aims to accelerate progress in reducing roadway injuries and deaths by utilizing a systems approach that brings together perspectives from planning, engineering, public health, data science, and robotics to the road safety field. We're one of two national centers with a designated research focus on transportation safety and the only center with a dedicated focus on safe systems. We bring together staff, faculty, and students from several UNC departments, as well as our partner universities and institutions listed here on this slide. For today's session on COVID-era street transformations, we are joined by Dr. Tabitha Combs, a research associate and lecturer in the UNC Department of City and Regional Planning. So we're excited to hear Dr. Combs' research today, and we've also got Dr. Krista Nordback, who I'll introduce later, along for the discussion. Housekeeping, before we start, you are muted as participants, but you can submit questions, and we encourage you to do so using the questions pane of the Zoom webinar platform. I'll be on the other end monitoring those, and we'll have about 10 minutes or so at the end to ask Dr. Combs to weigh in on your questions. We are recording today's session. CSCRS is going to make the recording available later. And just one helpful Zoom tip, you can choose the speaker view option at the top of your screen to optimize the view of the current speaker. So with that, Dr. Tab Combs, please go ahead and take it over, and I'll let you know when we can see your slides. Perfect, you're all set.
All right. Thanks, Dan. Really happy for the chance to talk about this effort to identify what cities learned through their COVID-related rapid street transformations. Before I get started, though, I want to recognize my partner in this project, Krista Nordback, as well as Mike Van and Luke Morin, who helped out a lot over various phases of this work. This research focused on one particular form of COVID street, and this was shared streets. So these are streets that prior to the pandemic were designed to accommodate cars in the travel lanes and possibly pedestrians and bicyclists at the margins. But during the pandemic, and due especially to pandemic related forces, they were converted into shared spaces through signage, through physical traffic calming, traffic diverters, with the idea of creating more space for walking, cycling, and outdoor recreation without fully closing streets to car traffic. We set out initially to figure out whether more robust planning processes led to more successful rollouts of these pandemic-linked shared streets. But we pretty quickly learned that success is hard to define and even harder to measure. So I'll tell you what we learned instead. In a nutshell, when you look at the COVID streets era as a whole, it's mass chaos. I don't know that we're ever going to be able to sort out its impacts on transportation, on safety, or on planning practices, given the truly wild variety of approaches and the ephemerality of most of these efforts. But when you dive deeply into what individual cities did, you'll see there were really deliberate steps that city staff were taking. These steps were often unprecedented, based more on gut instinct than hard data, but they were deliberate, had clear motivations in spite of all the chaos. Despite these carefully motivated and deliberate actions, though, most cities weren't in a position to gather robust, valid data on the immediate impacts of those actions. And for cities that did have count programs in place, those count data still don't tell us a whole lot. As such, we can't say, these programs led to X% increase in walking and biking. But we do know that cities learned a lot of lessons during this time, and that most of them are converting those lessons into new practices. So that's where we're going to focus. What did we learn, and how are we evolving as a field because of it? So I'll go over what we did with the count data first. We identified a sample of US cities that implemented robust shared streets programs because of the pandemic, kept those programs in place at least 6 months, published data on the exact locations of those shared streets, and happened to have continuous multimodal counters in place before and during the pandemic. We also identified a set of control cities that matched the treatment sample pretty well, except that they implemented only really limited COVID streets responses. It's a small sample of cities, only 16 total, and that's because our inclusion criteria were not easy to meet, but also because we supplemented the count data with in-depth interviews and case studies in each of the treatment cities. The 16 cities collectively had 195 continuous count sites with reliable data over our study timeline. And this is what we found from that data. So we identified an overall increase in walking and biking volumes from before to during the pandemic at count sites in our control cities, but not so much in the treatment cities. We found that ped bike travel patterns shifted overall from commute oriented before COVID to recreation oriented during the pandemic. The shift was more pronounced in control cities again. Finally, we found that ped bike volumes increased in locations that had more recreational oriented ped bike patterns before the pandemic and decreased in locations with commute oriented pre-COVID patterns. Again, more pronounced in control cities compared to treatment cities. But none of these differences were significant. So we really weren't able to find any discernible differences in ped bike activity between cities that did have and cities that did not have shared streets programs. So we tried another tactic, redefining treatment sites in terms of distance to an actual shared street rather than just being in a treatment city. And what we found then was that proximity to a shared street, defined as being less than 2 miles from that shared street, was associated with a drop in ped bike traffic volume. I'm not gonna lie, this was kind of surprising, a little bit disappointing to see, but it also helped lead us to some really useful questions. And those are, were the shared streets actually pulling ped bike traffic away from count locations? Were the counters not in the right place to capture pandemic era ped bike travel? Were shared streets located in places people just didn't want to go during the pandemic? And did land use somehow play a role in what was going on? We followed up on the last question, speculating that land use might actually have a role in whether shared streets were measurably attracting pedestrians and bicyclists. And overall, the answer seems to be yes. Both bike and pedestrian travel increased slightly in suburban and rural settings, more residential settings, and decreased in all the more urban settings we had. The greatest decrease we saw was for counters that were in downtown locations. And this suggested to us that land use is probably an important predictor of ped bike traffic during the pandemic. It's an important predictor of ped bike traffic in regular times as well, so it makes sense. And that raised another question for us. How did cities decide where to put the shared streets? Were they set up intended to increase bike and ped behavior and just didn't deliver? Or are there other ways we should be thinking about their effects and measuring success? So that, along with a lot of other questions, were the focus on the interviews that we conducted with people, city staff involved in planning, implementing, and evaluating shared streets programs in our 9 treatment cities. So in a series of hour-long interviews, we asked these city staff members how they decided to start the shared streets program, who was involved in decisions around planning, siting, designing and implementing their programs, and whether the public had any role in the effort. We asked how the shared streets program was received and whether or not it became permanent or allowed to expire after the initial COVID waves were over. And finally, we asked what they learned from their experience, what they would do differently if they had a do-over, and what new practices they saw emerging at the local level because of their shared streets experience. So we learned that shared streets programs originated from a variety of city departments, and they frequently involved cross-departmental collaboration. Regardless of who led the charge, there appeared to be a ton of thought and mental energy poured into these programs. And none of the cities involved police, not in their planning process, not in the actual physical rollout, or in any sort of enforcement. And most of our interviews were quite clear about this being an intentional choice. They didn't want these to be policed spaces, and they recognized that any sort of shared street scheme that relied on policing to function would neither be well received nor sustainable. We got a few motivations for shared streets that stood out as virtually universal among our treatment cities. The first was a desire to reduce viral transmission by providing space for physical distancing. Um, Next was restarting local economies after lockdowns by connecting people to jobs and to essential destinations. And third, and this was explicitly discussed in 7 of our 9 treatment cities and implied in the other 2, was using the reduction in vehicular travel, along with increased public demands for safer streets, as an opportunity to demonstrate and fast track previously planned actions. This last motivation, this opportunity to fast track, was directly reflected in the criteria cities used to decide where to locate their shared streets. In almost every case, they were at least initially aligned with what was called for in existing transportation plans. Ease of implementation was another really common and somewhat justifiable location criteria given the circumstances. And there were other crisis-informed criteria as well. Cities were concerned about traffic, whether or not temporary traffic calming materials could cut the mustard in high traffic areas of the city. They were also concerned about equity and whether or not the communities they felt stood to benefit the most from shared streets were gaining access to the shared streets. Now, to be fair, this concern did not necessarily translate to a just distribution of outcomes, nor did it translate to universal appreciation of shared streets for sure, but it did play a role in planning decisions in just over the half of the cities that we studied. The role of the public varied widely, with a few cities explaining that the urgency of the moment called for faster action than a public process would accommodate, and others describing how they established entire new public processes, including a couple examples of hiring community members to help lead planning and implementation. There were others who started with no public input at all, but evolved substantially during subsequent phases. And then the $64 trillion question, did the shared streets stick around? Largely yes, and largely because of initial positive feedback that staff received about them. 6 of the 9 cities rolled their shared streets programs into permanent programs. They may have changed quite a bit since their initial implementation in terms of location and design, but they are now a permanent feature within the cities. And in each of these 6 cities, it was a conscious decision. They said, this is working. Let's keep it going after the pandemic. And finally, we asked the interviewees what they or their agencies learned from their Shared Streets program and whether any new practices emerged from the experience. And this is when the fire hoses really opened up. The first thing we learned, and it came through everywhere, was that the Shared Streets experience generated new ways of thinking about streets. This includes new philosophies about street space, a concept that affected staff, elected leaders, and the public. Some version of the recognition that streets are for more than just moving cars came up in nearly every city, and in most cases was a primary driver of the development of new practices. We also heard of a growing appetite for experimentation, creativity, and sped up implementation timelines. People recognized they didn't have to put up with years-long waits for new infrastructure. They had the equipment, skills, and experience to act quickly, evaluate as they went along, and modify or roll back actions if they didn't work. And we heard this a lot. It's no longer acceptable to make our residents wait years for safer, calmer, lower stress streets. This new thinking is already translating into new codes and regulations and new standards for designs and materials. Several people reported they were working toward or already had codified new standards for shared streets and traffic calming, taking into account the ability to trial designs with temporary materials. Some of these new standards have grown from the successes of shared streets and feature specifics on how to deploy materials such as rubber curbs and planters. Others are the response to constructive criticism, like this feedback about local access only signage that had been part of one city's street design manual before the pandemic. So it says, I was talking to somebody who went through one of the slow streets, and he paused as he saw the local traffic only sign. He was like, I wonder if I'm allowed to bike through here. And I think, especially if you're somebody who doesn't feel comfortable being out on the street, that's not a very welcoming sign unless you live on that street and you know that you can be there. So based on this feedback, the city revised their street design manual, removing references to local traffic only and replacing it with signage about expected behaviors and speeds on shared streets. The number one lesson and new practice we saw emerging from shared streets is the use of in situ testing of new designs. So put something in and then see how it works. Cities took advantage of in situ testing opportunities in several ways. As an end run around analysis paralysis, so using the trial as the analysis, as a way to demonstrate to elected leaders and community members what shared streets can look like, so using the trial as a tool for education, and through on-site meetings, through walk-in talks, and through signage linking the online feedback forms as a way to engage the public and receive real-time experience-based feedback. This second quote really captures the in situ spirit well, I think. It's almost like a real-time experiment on traffic calming for our neighborhood greenways. The pandemic presented so many challenges for public engagement, but the differentiated impacts of the pandemic, differences strongly linked to race and income, underscored just how important robust and meaningful public engagement is. And while we know a lot of cities prioritized urgency over engagement, nearly every person we spoke with told us they felt their shared streets experiences strengthened their connections with community members, improved their communication pathways, and led them to develop new approaches to engaging with and learning from the public. Plus, the this is an emergency, we need to do something attitude that was so common early in the pandemic also provided sort of unprecedented grace for staff to make and then correct mistakes. This goes hand in hand with the emergence of the in situ analysis. While it's true that COVID streets responses were wildly unpopular in many instances, it's also true that by implementing them, staff received feedback on what communities actually did want that they likely never would have received otherwise. And in most cases, our interviews described how they took that feedback and used it not just to adjust their interventions, but also to rethink their entire approaches to engagement. In fact, quite a few people told us that they learned through mistakes and through lack of experience. In many cases, we heard how implementation challenges, lackluster outcomes, and sometimes negative feedback gave planners a new appreciation for the importance of context. Not every street turned out to be a good candidate for sharing. Not every neighborhood felt that shared streets would address the challenges they were facing. We also learned not all temporary materials are up to the job. Some can't handle the conditions. Others just don't make people feel safe. And sometimes some of the challenges neighborhoods are facing just can't be met through temporary materials and design changes. We heard this especially from an interviewee who expressed frustration that their city leaders didn't do their part by setting up regulations that would support safer streets, saying, I think the biggest challenge with the way it was implemented is the need for actual, some combination of regulatory change to make reduced speeds enforceable or make the no-through traffic enforceable. And finally, we heard that planning matters. This was admittedly not a common lesson, but hearing it at all makes me really happy as a planner. In two of our cities, we heard very strongly that the key to their city's shared streets programs and COVID responses in general was having a relevant plan in place to guide their planning and engagement processes. And in both those cities, there was a recognition that plans can not only withstand disruption, but can guide cities through them. And those are going to be increasingly necessary as these disruptions become more and more a fact of life rather than once in a generation events. And then coming back full circle to our initial count analysis, we heard frustration with the lack of data to analyze, document, and communicate the impacts of these rapid implementation projects. As one person put it, it's hard to get data, much less valid and reliable data, to evaluate the impacts of interventions when you're relying on volunteers to gather that data. So staff absolutely recognize that more structured and intentional evaluation programs laid out in advance in well-crafted plans that were sufficiently funded, managed by trained staff, are essential to understand the impacts and being able to communicate the impacts of rapid rollout projects. So, main takeaways. Ooh, this is quick. The cities in which we conducted case studies, all of which had robust shared streets programs, had relevant plans in place and consulted them heavily during the shared streets planning processes. Public engagement started out on shaky ground in a lot of places, but as staff got their COVID footing, they adjusted, expanding and improving public engagement in ways that are likely to outlast the pandemic. Existing count programs likely won't adequately capture the true impacts of rapid rollouts and quick builds. Cities need a more deliberate approach set out in advance, ready to roll when they're needed. And finally, the knowledge to support new best practices for transportation planning and street design in a post-COVID world is already here, but it's embedded in the experiences of the professionals who were on the ground doing the work. And it's likely to get lost as we put the pandemic behind us. So it's critical that we work fast to help people tell their stories and share their experiences. So as a field, as transportation professionals, road safety professionals, as planners, we can work collectively to develop new profession-wide best practices. Thank you.
Great. Thanks so much, Tab. Really great presentation, and those findings are certainly transferable and can inform a lot of our future work. I want to also welcome Dr. Krista Nordback, who's a senior research associate at HSRC, the Highway Safety Research Center, who contributed to the project and is here to answer questions as well. So, Krista, I think some of these might be up your alley, but I think I'll read them off, and then maybe you all can decide who's best one to answer them. This might be getting at some of the differences in those overall count data trends that you got at the beginning, but someone's asking, why do you think that count data sort of went in the opposite direction, as they say, or that seemed, and you covered some of this already. I wonder if you could recap that, like why those counts might have moved in those different directions than we might have anticipated.
So obviously these locations were not set with any intention of or pre-knowledge of the COVID streets. So they just happened to be in the same city, and especially for the walking, one would like to have a bunch of counters within quarter mile, maybe half a mile, and we just did not have enough data within that walk shed to do analysis. So this is fundamentally going to limit what we can learn. So then we did have these counters that are located all sorts of places, some of them suburban. And so that's what I really take away, is that's what we really can learn, is that suburban locations saw an increase and the central city, not so much. And whether we can say anything about treatment cities and control cities, I am not confident about coming up with a conclusion on that. That's just what the data happened to show, but that may have nothing to do with whether there was a treatment or not.
Got it. Thank you, Krista. Were there any figures, numbers, findings gathered regarding safety for the shared street applications compared to before their transformation into that type of treatment? We've been talking about sort of overall activity, right? Just curious if there's a safety component there that could be measured.
So we asked questions about that, about how cities evaluated the impacts and what they were looking for. And that was only mentioned in one of the cities that we spoke with, where they had explicitly tracked crashes and near misses. And they found that on these shared streets, crashes and near misses that had been reported went down. But that was the extent. I was kind of surprised, but I think, it's also, this was, as I said, this was chaos. These were chaotic times, and it's hard to track safety in a meaningful way, even in regular times. And so I'm not surprised that we didn't see more data on it other than just crashes.
It makes a lot of sense. The next question was, okay, this person says, sorry if we missed it, but did you control for time trends when measuring about the change pre and post treatment? And what was the timeline for measuring the average ped bike counts when doing this work?
So we looked at the annual average daily pedestrian traffic and bicyclist traffic, separating the modes except for a few places where they were just combined and we couldn't separate them. So that means that we were looking at 2018, 2019 as our before case, 2020 as our kind of treatment time period, and then 2021 as the post time period. So that's how we didn't get into month by month or any of that. Does that
And
answer
it's
the
really
question?
tricky because some of these interventions moved around as cities would pilot one location and then go to another. It's it's really hard to get a handle on what was happening when. So we had to try and generalize a bit more than that.
Great. This is an interesting question. Are there any efforts underway, maybe from the cities themselves or from others, to document and share their experiences and their lessons learned with other cities that were maybe less aggressive in this implementation or didn't really become part of that movement in the initial response?
Not that we heard in this particular study. We have another study underway where we actually try to figure out what those lessons were that these more robust, aggressive cities could share with the ones that were slower or were lagging in some way. And so we're working on that. There are a lot of factors that cause some cities to be able to do a lot, and some cities not be able to do much. And a lot of those are external to the cities themselves. But we are trying to figure out how we can take the lessons and the experiences from the aggressive cities and create guidance for those who were not able to roll things out as quickly or comprehensively.
Got it. A note here, it's apparently San Francisco recently published an evaluation report on their slow street program. So maybe compiling some resources like that will be useful for others. A question I should have gotten to earlier is there a written report or publication that folks can refer to documenting any of this work that I can send the link out for?
There will be.
Okay, great.
There's not
we'll
a
ask
link
everybody
yet.
to keep an eye on that then.
Yep.
Cool. We are nearing the end of the time together. I'm going to ask this one question. We've got one more. This person is asking, do we have locations in specific locations that made permanent changes that other agencies can look at to it, for example? So maybe taking what was initially temporary and going all the way with it and keeping it on the ground.
Yeah, there's actually quite a number of cities that decided either early on or after getting positive feedback that they wanted to make their programs permanent in some way. 2/3 of the cities that we studied in our treatment group fit that category, and I'm seeing evidence that some of the others are also creating more permanent programs that are just a little bit evolved from what they learned during COVID. So yeah, definitely we're seeing examples of things that have been made permanent, but with adjustments.
Okay. Well, we're nearing the end of our time. Dr. Tabcombs and Dr. Kristen Norbeck and your team, thanks so much for your work on this and sharing your story and your results. We'll look forward to reading more in the future publication. I did want to take a moment. This is our final installment in our monthly Research to Practice Bite series, and just wanted to thank you all for joining us each month for these important discussions and really helping us move toward the safe system that we all want to see. We covered a really wide range of topics, everything from micromobility, automated vehicles, media framing, and even pitfalls in our shift toward a safe system approach. We enjoyed having you here with us each month. We're going to continue hosting the archived webinars, and we hope that those will be useful to you all in your work to prevent deaths and injuries on the road. I want to thank the panelists, my colleague Jennifer Palcher-Silliman, who did the lion's share of the work pulling these together each month, and the entire CSCRS consortium, our partners, and then you all especially for turning out each month and joining us. So thank you, and we hope to work with you all again soon.